All right, Average Joe here with you, episode number 11. Hope you guys are having a great weekend. Hope it won't be too windy for you so you can actually hear me over my ear pod thingies here. So, and tonight we're going to discuss about that SI joint. Hopefully you guys like that one, the hip pain one I brought this weekend. Or if you want to discuss the spinal traction decompression, talked about that one too. Did that one a couple days ago, and I'm just finishing up my next video, which is going to be on lower back and sciatica and how there's the different positions, sleeping positions, the safe ones that you can do to help reduce your lower back and sciatica symptoms when you're trying to sleep. So I got that coming out. So there's 4 different positions that you can put yourself in to hopefully, definitely should get you to sleep a little bit better. So hopefully you guys will check that one out. I'll probably end up finishing that one up tonight and dropping it tomorrow. If you guys have any requests, you can always leave me a DM down below. I'll take a look at it and hopefully maybe I'll make a video just for you. That'd be kind of cool. Uh, so yeah, this is been a hot day out here today, and definitely gonna slow it down so I don't pass out because it is. You know, the sun's going over the horizon. It's still kind of hot out. Uh, let's see. Let's talk about that SI joint. So I did a couple muscle energy techniques in that video, MET, and one of them was the shotgun method, which is a pretty simple one. It's kind of like just a generalized mobilization for the SI joint, sacroiliac joint, and the other one was when you're having a hip alignment issue where one hip is rotated forwards anteriorly and the other hip is rotated posteriorly or backwards, and your sacrum is tilted. So you have this tilting effect of your sacrum. So that part hopefully should help it because I'm having you engage the hip flexors on one side and the hamstrings and glutes on the other one to help rotate that a little bit. And hopefully you guys would like that one. There are several other mobilization techniques that you could do, but it has to do with how the sacrum is tilted in space. So the sacrum moves 4 different directions. So it goes forwards and backwards, then it can go side to side, and it can go the other side to side. And so depending really on not only if your hips are level, but also that sacrum, that tailbone area, making sure that's in the right position. So that piece gets a little bit more complicated, and I didn't want to dive into that much that episode for that piece of it. That's the reason why I left it out. Maybe in a future episode, I'll talk about nutation and counter nutation and sacral tilting, and I mean, you can do a whole video on that. I'm not sure people would like that too much. Excuse me, you can get lost in the weeds with the terminology and unless you're really interested in it, it's not really something that's probably fun to watch. So, uh, you know, anyways, if you'd want to see that, you can always leave me a DM down below. I can go ahead and do a video or two on that one. So, and maybe I will someday. Who knows? Um, so And then I really did a nice relationship between lower back and SI joint. You know, how the heck you tell the difference, right? Because it's all in the same area. I mean, you can have back and SI joint pain. You know, you don't want to treat one and not the other, and you're still having a lot of pain. So I did go over that in that video. How do you really tell the difference between the two? So it'll give you a better sense of where you should target your problem at. And that was the sense of that episode. I did go over a couple stretches. I did go over the piriformis stretch. I did go over the iliopsoas stretch, um, which are really the most two important stretches when you're having SI joint pain. And you always want to do both sides. Excuse me, because we're really given a generality of a hip problem, and you don't want to become asymmetrical with one side's tight and the other one's loose. So you're better off just doing both sides to be symmetrical. And then my decompression one, my traction one, didn't do well initially, but it kind of started to pick up some steam, you know, and really going over the hype of it and the various types and kind of the do's and don'ts when, you know, when should you do static traction at home and when you shouldn't. I think kind of the basic protocol with it. You know, you should hold for 5 to 10 seconds, then rinse and repeat. Hey, how you doing? Like the truck. So, anyways, um, hopefully you guys like those 2 episodes. And hopefully if they give you some information, hopefully it's like, gee, because I've been doing that wrong, or maybe it can help you at a party when it comes to, I don't know why we talk about traction or talk about sacral iliac issues, but at least you'd have some idea what the heck's it mean. So, anyways, so in my next video, like I said, I'm going to be dropping here probably tomorrow, which is kind of tricky because it's not Mondays. You usually, you know, people are going back to work, you know, unless you work the weekend and you have Monday off. So it might fall flat if no one wants to watch it, but I think it's a pretty decent one. And like I said before, it's basically the 4 different positions that you'd want to be able to get yourself into to reduce pain in your back and if you're having nerve pain when you're trying to sleep at night. So, and I hadn't really talked about that before. You know, I've shown something, maybe a photo or something like that, but I've really never dived into, um, you know, the different positions and why you would and why you wouldn't do them. So, hopefully you guys like that one. But I guess let me tell you a horror story, because you know what? That's what these episodes are all about. Average Joe and the horror stories he's gone through. So this was a long time ago now, probably at least a decade ago. I was out seeing a patient. I was working in a nursing home at the time. Well, I was working there part time. I was working at the hospital full time, and then I was in the evenings. I was working at senior nursing facility, and so anyways, this nursing facility. I mean, been there a long time. 3-story building. The walls are made out of concrete, painted like a dark brown. Some places black. So really, let's just say, it wasn't the most upbeat place you'd want to be trying to recover. And they had what's called a long-term care unit, or an LTAC. And these are people where, you know, I guess, and back in the olden days, they used to call them rest homes. You know, it's kind of their last stop before they head off to the morgue. And that's just the facts of it. You know, some of them have neurological problems. Hi. Some of them have, you know, some sort of Parkinson's, multiple sclerosis, stroke. Hard to tell. So needless to say, that place was, it was depressing at times. You know, I'm trying to be cheerful with them, but it was a tough one. And I remember seeing this one patient. It was so sad. She was a young woman. I mean, in comparison, the rest of them, they were probably in their 70s or 80s, and some in their 90s. She was in her 50s, and she was just all crippled up. Apparently, it was a spinal cord injury at some point in her early life. Her parents end up dying, and then she's got no one to take care of her, so essentially awarded to the state, and then the state sends her to. I mean, the state she ends up getting Medicare and Medicaid, and then she ends up winding up there, and on that floor, unfortunately, they didn't take care of people very well. So I was working on her with, trying to get her up to the chair, to try and reduce bed sores and, lung infections and urinary tract infections and contractures, all these things that happen, blood clots when you don't move. So it was that was a horror story. It was a real sweet lady. She didn't say a whole lot. I think she had mumbled a few words here and there, but you could tell where she was appreciative when you would come there and just talk to her and try and work with her, because I'm sure she was lonely and sad. And as far as I'm concerned, that's anybody's own personal hell right there. That description I tell you about. I mean, my personal thoughts. I'd rather pass on than live and suffer like that. Poor girl was only existing, so I'd spend a little extra time just to try and talk to her. And she had a TV, talk to her about current events and stuff like that. And you'd see her face kind of open up a little bit. So, and I was here probably on and off for probably 6 or 7 months, something like that. And so that was huge. And another story, same place. There was a guy there. He had lived. He was in a wheelchair, and he could get up and transfer, but that was about it. And he had more heart attacks than you could shake a stick at, and he had several stents. I mean, probably 15 different stents in his heart. So, and he had lung issues, and he was on oxygen, and he was having issues with blood clots in his legs, and so I always try and help him. And he was a nice guy. He kind of he wanted things his way and only his way, and so I respected that. So, but I'd seen him for I think 3 visits. I was trying to work on different cushions for his chair, and I came in. They didn't need me for I think 2 or 3 weeks, and then I came in one evening, I think on a Tuesday, and he had gone to the hospital complaining of shortness of breath. He couldn't breathe, and he never came back. That was it for him. So he probably ended up having another one of those blood clots, or maybe it was something. He had so many stents in his heart. I mean, he was such a high risk of and then having previous heart attacks. So I mean, he knew his time was limited. Nice guy overall, though. But you see that and you're like, okay, I ain't got it half that bad. So the world gets small really fast when you start working with and dealing with and having to interact with people who really do have a lot of issues in life going on. So, well, I'm gonna go ahead and leave this one at this point. Hopefully you guys like those couple of videos, and look out for the next one. So until next time, Scully, and I always like to say, look up and keep smiling. See you next time, folks.